Fibroids are non-cancerous growth in the muscle of the womb. When the cells within the muscles, they start growing and form a growth or a lump within the muscles of the womb. And the fibroids are caused by a female hormone called estrogen. When there is excessive growth of estrogen hormone, that is when the cells start growing and they form a growth. The fibroids do not cause weight gain. However, if you have increased weight or increased BMI, that can rather be the cause of the fibroids, because the excessive fat tissue within the body produces more estrogen. And as I said before, estrogen is the cause of cell growth within the muscle of the womb, and it causes more growth and more fibroids. So the main symptoms of fibroids are bleeding, pain, and pressure symptoms. Bleeding can be in the form of any abnormal bleeding from the lining of the womb. It can be heavy bleeding. It can be bleeding in between the periods. It can be random irregular bleeding at any time of the period. And the pain can be during the periods. Pain can be outside the periods, backache, pressure pain, and pain during intercourse as well can be related to fibroids, depending upon the size and the site of the fibroids. And the pressure symptoms can be in the form of pressure on the bladder, making you go to pass urine more frequently, or pressure on the bowel, which can cause constipation as well. So fibroids are usually, if they are usually diagnosed by ultrasound scan. However, if they are large enough to be palpable by the patient, sometimes the patients come with a complaint of mass in the abdomen, which is very easily palpable on examination as well. Ultrasound confirms it. However, MRI scan gives more resolution to the site and the size and the number of fibroids, etc. And all this information is useful to make a management plan. So the cause of fibroids as such is unknown. However, as I said, that the cell growth is prompted by the estrogen, which is a female hormone. Hence, the periods of life when the hormones are very high, for example, in reproductive year, the fibroids are more common. And when the hormones start going down, for example, in menopause, the incidence of fibroids starts to go down as well. So it is mainly the estrogen hormone which causes the growth. So the fibroids are, as I said, is a small growth, and there can be various different sites within the womb. They can be variable in number. There can be variable in position where they lie. And the signs and symptoms of fibroids depend upon the site, size, and number as well. And hence the treatment will also depend upon what the symptoms are. So the medical management of fibroids is in the form of improving the symptoms, not taking the fibroids away. And if the symptoms are bleeding, then the simple medication which is given for heavy periods like mefenamic acid, tranexamic acid, which reduces the flow of the bleeding, is the first line of management. However, all the medications in the form of progesterone implants, progesterone injections, Mirena coil can also be given to reduce the bleeding. Mirena coil can only be given if the length of the cavity is suitable for coil insertion. Sometimes due to fibroid growth, the length of the cavity and the shape of the cavity might not be suitable for insertion of a coil. And there is a medication called gonadotropin releasing hormone analogs. In a simple term, these are the injections which are given once a month, and they can reduce the flow of the hormones within the body by having an impact on the brain cells which help with the hormone production. And they can sometimes reduce the size of the fibroids as well. But these injections cannot be given on a long-term basis. So that is the side effect. It can be given for a small period of time, maybe 3 months or maybe 6 months. pre-surgery or just to reduce the size of the fibroids, to reduce the pressure symptoms, but it is not something which can be given forever because the side effects are menopause-like side effects and effect on bones, etc. And then coming up to the surgical management has gone a lot of in advanced level for fibroids right now as well. Fibroids can be removed through laparoscopy, through open surgery, but the fibroids are only removed when we know that this particular fibroid is the cause of the symptoms, because fibroids are never one in number, they are multiple. And once we start removing one fibroid, the uterus can produce even more fibroids. So fibroids will only be removed when they are close to the lining of the womb or hanging in the lining of the womb, causing bleeding, or it is distorting the shape of the cavity to such an extent that it is causing maybe fertility problems or miscarriage, or the pressure symptoms due to large fibroids. In those circumstances, only fibroids can be removed. And then there is a method where fibroids can be removed through hysteroscopy. Hysteroscopy is the camera test, which when the camera goes through the neck of the womb, we look at the inside of the womb, and if there are hanging fibroids, they can be removed as well. We very recently, for the last few years, have something called ultrasound focused treatment, which can be MRI guided or ultrasound guided. It is available in some of the hospitals, and we work very closely with the radiology department to provide all the new advances to our patients as and when they are available. So this is something which we can discuss as well. And another option which has become very popular in the last decade is uterine artery embolization, where a needle goes through the groin, through a vein in the groin. It is done by the radiologist, and small particles of foam are left in the blood vessels, which means there will not be much blood supply to the fibroids, and the fibroids do shrink after uterine artery embolization. However, this is something which can be decided by the radiologist whether this procedure is doable in a particular case or not. And that also depends upon the number, size, and site of the fibroids. Fibroids are benign tumors. They do not get converted to cancer. The risk of cancer with fibroids is less than 0.1%. Hence, there is nothing to worry about if they are not treated, and if they are not causing any symptoms, they should not be treated. Fibroids are very, very common. 1 in 3 women will have fibroids at some stage in their life, and out of those, only 1 in 2 fibroids will cause symptoms. So more than half the fibroids might not cause symptoms to some women at all, and they might be picked up at the time of a routine ultrasound scan for some other problem. Hence, if they are not treated, it is not a problem as long as they are not causing symptoms.